back, so day 7. A couple different problems today, nothing really major. My legs are really achy, probably from just up moving around more. My hip hurts when they do the bone marrow draw. I don't know if they do that on all the surgeries, but my surgeon actually drove into the bone, into my hip, pulled out the bone marrow, got the stem cells, spun them down and put them in my back to help the growth of the new bone. So my hip aches a little bit today, my legs are kind of achy, I'm a little tired today, but again, I'm not taking nearly the medications they give you for the pain. I think on average, they give you 10 milligrams of Percocet every 4 hours for the first few weeks. Like I said, I'm taking 10 milligrams per day, and usually just at nighttime. I usually take 5 milligrams about 9, and about 3 in the morning I take another 5 milligrams. So I'm trying just Tylenol today, and like I said, overall I can still get up. I'm sitting down good. I'm laying on my side much better now. My mobility is good. I can pick my legs up, no problems. I can bend over easily and pick things up. I'm gonna get in the shower today to let you know how that works out. Should be fine. Got to keep everything dried off and cleaned off, and I'm going to do some updated photos throughout these. I don't know if I'm going to put them all in one little collage or if I'm going to just, every one of these days I'll segment them in. When I take the dressings off, I'll show you pictures of the bruising or the the incision points. The biggest thing is try not to get infected, so I don't leave the dressings off for long when I change them, so I don't always take pictures. Everything right now on my back is perfect. It looks like a nice little straight line and staples. There's no redness, there's no itching, no scratching, nothing wrong. And again, my abdomen, the incision itself looks good, but I'm still having a lot of problems down around my lower pelvis. Again, problems. Just a lot more pain down there. And again, when they go in, they cut you here, they stick a hand in there and they take all your organs and push them over to the side. Then they put clamps in there and retract you back so they can get to your spine through your front. So you're going to hurt. I don't see any way of not doing all that without hurting. Now, last thing, I'm 7 days in. That's something else. When you move all your guts over, everything goes back into place. And without getting too much into all that, basically everything still settles back in. So every time you eat, you get bubbling and gurgling and things moving around and things not moving around. So you got to get kind of used to that for the first few days. I'm at the point now where I can eat now, and I still get a little bit of gurgling and bubbling, but for the most part, compared to like the first couple of days, every time you would eat or every time you would do something, your intestines and your bowels and your stomach is just starting to go back to work again, basically waking back up from the anesthesia. So you have a lot of gas pain, a lot of cramping pain, which don't help with your back pain, especially once it gets down lower. Anyhow, that's it for today. Check back with you tomorrow.